Last but very much not least is Dr. Danielle Martin. You know, I think it is high time that we started taking a look at what countries around the world were doing in providing quality care to all of their people in a far more cost-effective way than we do. And one of the examples of a single-payer system that is working well, that is popular, is the Canadian system. Dr. Martin is a Canadian physician, healthcare administrator, and an associate professor at the University of Toronto. She is the author of a Canadian best-selling book, Better Now, 6 Big Ideas to Improve Healthcare for Canadians. Dr. Martin?
Thank you, Senator. I must say I'm very grateful that so many Americans are interested in learning about the experience of your Canadian neighbors under our single-payer healthcare system, which we also call Medicare. As a practicing doctor, a hospital administrator, and a citizen, I am so proud to be part of a system where access to doctor and hospital services is truly based on need, not ability to pay. And I'm not the only one. In public polls, 94% of Canadians say that our healthcare system is a source of personal and collective pride, even more than ice hockey. Single-payer healthcare is a symbol to us of what it truly means to be Canadian, that we take care of each other. Now, my grandparents immigrated to Canada in the early 1950s, like so many people who come to this country, hoping to build a better life for their kids. And at that time, there was no universal health coverage in Canada. So when my grandfather had his first heart attack in his early 40s, his world was shaken. And by the time he died nearly a decade later, the family was essentially bankrupted by medical bills. I know that this remains a reality for many in the United States today, but you should know that just north of your border, that kind of a situation is essentially unimaginable. My generation of Canadians does not remember what it was like to worry about paying a doctor or a hospital bill. And despite our challenges, which of course every country experiences, Canadians have a longer life expectancy, lower infant mortality rates, and fewer preventable deaths than in the United States. Single-payer healthcare is also, as you know, less expensive. In Canada, our administrative overhead is less than 2% in our public plans, as compared to 18% in the private plans here in the U.S. We spend just under $5,000 per capita in Canada to cover everyone. You spend nearly $10,000 per capita, and yet tens of millions of people are uninsured. But most importantly, when my patients are sick, I do not need to ask if they have insurance or if they can afford to pay for my services. And throughout my pregnancy, and for the birth of my daughter in a world-class hospital, I was never asked for money, and I never received a bill. I just handed over this card, my Canadian healthcare card, to my doctor, and that was it. I wish that all of my American neighbors could experience the same simplicity in their moments of need. And I hope that the American people will seize this opportunity to declare to each other and to the rest of the world that you do believe access to health care is a human right. Thank you.
Thank you, Dr. Martin. Today, all of us stand before you and proudly proclaim our belief that health care in America must be a right, not a privilege. Today, we begin the long and difficult struggle to end the international disgrace of the United States, our great nation, being the only major country on earth not to guarantee health care to all of our people. As proud Americans, our job is to lead the world on health care, not to be woefully behind every other major country. Today, we begin the debate vital to the future of our economy as to why it is that in the United States, we spend almost twice as much per capita on health care as any other nation on earth, and yet we have 28 million people without any health insurance and even more who are underinsured with high deductibles and co-payments. As a result of the incredible waste, bureaucracy, and profiteering in our dysfunctional healthcare system, we are now spending nearly 18% of our GDP on healthcare, $10,000 per person. Incredibly, if we continue the status quo, we will spend an estimated $49 trillion over the next decade on healthcare. That is economically unsustainable for our country. Today, we say the function of a rational healthcare system is to provide quality care to all in a cost-effective way, and not to continue a system which allows insurance companies and drug companies to make hundreds of billions of dollars in profits each year, and to make healthcare industry CEOs extremely wealthy. Further, as you've heard this afternoon, the function of a good healthcare system is to enable people to get the healthcare when they need that healthcare, not to deal with an endless amount of paperwork and to spend hour after hour arguing with insurance companies about whether or not you have the coverage for the procedures that you need. The strengths of a Medicare-for-All program are not only its universality and its cost-effectiveness. It also ends the complexity of a system which adds enormous stress at a time when people need it the least. And today we say to those families in Vermont and in Wisconsin and California and all across this country who are spending $10,000, $15,000, $20,000 a year on health insurance, that we understand that this is insane and unaffordable to be spending that much money simply to protect the well-being of your family. And we're here to tell those families and people all across this country that under Medicare for All, the average American family will be much better off financially than under the current system, because you will no longer be writing checks to private insurance companies. While, depending on your income, your taxes may go up to pay for this publicly funded program, that expense will be more than offset by the money you are saving by the elimination of private insurance costs. And today, we tell the drug companies that the American people are sick and tired of the greed of the pharmaceutical industry. We are no longer going to get ripped off and pay the highest prices in the world for prescription drugs under Medicare for All. We're going to negotiate lower drug prices for the government and for every single American. And today we tell the business community, especially small and medium-sized businesses, that we understand that you want to focus on your core business mission, not to spend countless hours worrying about how you will provide health insurance to your workers. And Medicare for All will allow you to do that, because all of your employees, by right, will have comprehensive health care. And today we say to millions of workers that you should not have to be stuck in a job that you don't want just because it provides decent health care to your family. With health care as a right, you will finally have the freedom to do the work you love and are passionate about, and our economy and our nation will benefit from that.